Ladies and gentlemen, good afternoon. Thank you for tuning in to the MS Golf Performance Podcast. We're here with Dr. Marris, Doctor of Physical Therapy in the Hilton Head, South Carolina area. Dr. Marris, thanks so much for joining us. Please, if you could, just tell us a little bit about yourself, what you do, kind of your day-to-day in Hilton Head Island.
Yeah. So I'm a physical therapist and I'm practicing for just about a year and a half now in Hilton Head, South Carolina. I graduated with my doctorate in physical therapy from Walsh University in 2019. Practicing the outpatient physical therapy realm. So I see mostly orthopedic cases, some balance and neurological, but mostly orthopedic. Post-op care or chronic pain tends to be our population. Yeah, and that's my day to day.
Excellent. How did you ultimately become interested in physical therapy? What kind of brought you into the world and made you want to pursue it as a career?
So my dad is actually a physical therapist assistant. So growing up, I always went to his office. Going into school, I knew I wanted to do something medically related. So throughout undergrad, just through my courses and everything, decided I wanted to use exercise as medicine to heal the body instead of other what's the word I'm looking for? Other avenues. So I did exercise science as my undergrad major and then went on to physical therapy school.
Awesome. Excellent. In your opinion, what would you want people to know about physical therapy that they may not know or may be a misconception in their eyes? I know you and I have talked a lot about this based on some of the injuries I've had as a golfer, and I know you probably treated your fair share of golfers in the area you kind of are in. What would you want them to know kind of about physical therapy if they need to be pushed over that edge to take you up on it?
I think I was actually just talking about this with one of my patients this week. I think a big misconception is the no pain, no gain mindset. And it happens a lot in sports in particular, because in the past, I mean, there's certain cases where you need to, push through and be mindful. But in the majority, your pain is your body's response in how you're overdoing something, or you're stressing it too much, and so not being respectful of that pain threshold, I think has been a detriment to our field and a mindset that makes people not want to seek physical therapy care. Another aspect is physical therapy isn't just rehab. Like we have tools in our toolbox to help prevent injuries as well, and work with other professionals and how to prevent injuries in all populations. So I think that would be another misconception.
Definitely, and I think, like I said, for those of you who don't know, I met Danielle down in Hilton Head Island. I was working in an off-course facility down there, and we spoke a lot about physical therapy specifically with some of the surgeries I've had, and some of the worsening back injuries I had at that time. And I think that's probably the most common one I hear, is that athletes think that it's necessary to push themselves through pain to seek a goal or a achievement. And I can tell you firsthand that that's just doesn't work. It often makes the condition worse. So I'm glad you said that, because that's definitely one I wanted to touch down on. So moving forward, in your day-to-day career, I'll say, what do you think, what lack of flexibility or functional movement do you kind of see the most in your patients?
That's a hard question, because it really just depends on what's going on. I think if I had to generalize it, just thinking about the people that I see and the location I'm in. So in a high retirement community area. So I see a lot of people, either high schoolers or I see, 65 and above. So take that into consideration. But I would say in those two populations, the biggest deficit would be strength, and then closely followed by like flexibility and extensibility of joints, of muscles, and how it impacts how you move. But I would say I would prioritize probably strength over most. People tend to overuse some muscles and underuse others, and that muscle imbalance is what can, over time, is what leads to the majority of the pain that I see. It's not, I don't see a ton of like unforeseeable injuries that people, they fell, they tripped, something. That's not the biggest part of my caseload. The biggest part is overuse, chronic conditions that have developed over time and worsened over time, and to the point that, they get, I need to go get this checked out type of thing. So I would say strength for sure.
Do you think that differs more or less in kind of the age gap? And if we're referring to someone young, do you see it more on the strength side or more on the flexibility side versus someone who's, let's say, in their late 60s, early 70s? Do you see it more along those lines or in the youth athletes?
I would say in youth athletes, it tends to be a muscle imbalance. So they have really, really strong muscles that dominate their sport and help them do their sport, and really weak muscles that contradict that movement or help stabilize that movement. So it tends to be that muscle imbalance that causes their problem and their stability deficits. But whereas in the older population, it really just depends. It tends to be like a core and pelvic strength deficits. Also, side note, I see a lot more lower extremity than I do upper extremity. So their core and their hip weakness tends to contribute to everything. So back, hip, knees, ankles, can all come back to that proximal strength. So I thought that would be the biggest difference between those two age groups I see.
And we see a lot of injuries in golf that can go back to the core. I know with me personally, a lot of it's come back to the core. We see a lot of injuries out on the PGA Tour that are ultimately kind of core-related injuries or core stability-related injuries. So for anybody listening, that's going to be ultimately one of the most important things you can do is make sure you have a strong core and better those muscle groups that you use every day. Make sure they're balanced. That's the key word. So do you think, in your experience, that physical therapy should be a alternative or at least a starting point for injury prevention or injury maintenance over surgery?
100%. And I mean, I'm biased because I'm a physical therapist, right. And there are, certain cases that need surgical intervention, but 80 to 90% of cases can be managed conservatively if they just look at the whole body as a whole and use that holistic approach. I think surgery should definitely be a patient's last resort. And they should try other conservative avenues before they return to that option. Because like I said, a lot of times a chronic pain is in response to imbalances within the body in terms of strength, flexibility, joint mobility, whatever that may be. And so a lot of times the pain is a secondary, it's not, that area that's hurt or wrong. It's like as a response to something else. So taking that kind of holistic approach, you can manage something without introducing the pain and, limitations that come post-surgery. Because a lot of times, and what I've seen, because I do see a lot of post-op, is tends to be a lack of education for patients preoperatively in what their post-operative care is going to look like. So, I see a ton of post-op rotator cuff tears and repairs, and, it's a very long rehab in that particular case. And people just aren't properly prepared for, you will not be returning to golf or tennis or anything like that for at least 6 months. Right. And that kind of timeline isn't prepped. And then they're like, oh, it still hurts. I can't move it. And I'm like, this is expected. You weren't just going to go into surgery and wake up and it be fixed, because a lot of people have that mindset. I go into surgery, I come out, it's fixed. and they don't realize the 6 months of rehab that you have to do between surgery and fixed.
Right. And we've definitely had that conversation in regards to some of the injuries I've had. I think that kind of just goes back to the mental side of surgery being often as much, if not more challenging than the physical aspects of it. I think people get it in their head that after surgery it's going to solve all the problems they've been having, prior to getting it. And sometimes that's not the case. Mentally, it can be detrimental, just in how you recover. So I think that's a great point. I think more emphasis should be on starting with physical therapy myself, as kind of an unbiased outsider. I wish in some of the work that I had done, I kind of took a second look and stepped back a little bit, just to make sure that it was 100% necessary. And unfortunately, that's how we learn. But that was definitely a great point, and I'm glad you brought that up. What are some of the advancements in the last, I would say, 5 years that you've seen really on the physical therapy or sports medicine side of things that you really don't know how you would have been able to continue without it, in terms of technology or innovation?
Yes. So, asterisks, I've only been practicing for about a year and a half. So 5 years, exceeds my experience in the field by 4. Yeah. But, I was a student before that. And so I was in the clinic.
So you've seen it all.
Right. And I would say, so I don't have access to it anymore because my facility doesn't have it. But one of the by far coolest pieces of technology I've ever seen is an anti-gravity treadmill. And I used it a ton in my last rotation when I was in school. And you can use it for your athletes. You can use it for your geriatric population. Your chronic pain, people that haven't been able to walk without pain, you put them in it, you zip them up, it inflates, and they're at 50% of their body weight, and you can gait train them. You can get them to fix their chronic, motor patterns. And it was one of the coolest pieces of technology. You could get an athlete that was, 40 to 50% weight bearing running, because you could get them 40, 50% weight bearing and still have them train. So by far, if I don't even know, they're like 20 or 30 grand.
They're expensive. Yeah.
They're crazy. But it is by far one of the coolest pieces of technology I've seen in rehab. That followed by blood flow restriction training. I haven't had a ton of exposure to it. And there's a lot of considerations in your population, but you can get a lot quicker strength gains with using it, and especially your athletes. So, and that's much less expensive.
Yeah, I saw the zero gravity stuff is unbelievable. I got a chance to see some of it at one of the World Golf Fitness Summits I went to, and they are the coolest thing in the world. I don't know enough about it to really form an opinion on it, but the look of it and just how beneficial it was to just such a wide demographic was awesome. I thought it was the coolest thing in the world. Now, furthermore, going down, how can athletes benefit from proper physical therapy and prevent further damage or injury?
Sure. So physical therapists are how we're trained. We're trained to be movement specialists in a certain kind of avenue. And we can take a look at how you move and where your strength is and watch you just function and see where your deficits are and what you're placing more at risk with how your movement patterns are in your sport and everything like that. Caveat, if you're looking to improve your performance, like in a golfer per se, they're wanting to get a certain expectation out of their sport, put ball into hole. I want to do that quicker. Right. That is not my area of expertise. Okay. If you want to be better at putting the ball into the hole, that is not me. If you want to do your swing and let me look and see, oh, I have a lot of pain at this point in my swing, or, can you just look and see if I have enough mobility in X, Y, and Z, that kind of thing in my realm, and, how you can prevent furthering pain or furthering any condition, or, being mindful of, I don't have a great back. How is that going to impact